Here. Hi, good morning. Today is Tuesday, April 20th, and this is the regularly scheduled meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using a teleconferencing format for today's meeting. We are all participating via the World Wide Web. If you'd like to make a public comment today, please make sure you are identified by name in the WebEx system. For those interested in commenting during unscheduled appearances, please use the raise your hand feature and wait to be recognized. Each speaker will be allowed up to 2 minutes for public comment. Each vote today will be a verbal or voice vote so that members of the public can hear how each board member has voted. After we have had a motion and a second regarding each item we are taking up today, we will be doing a roll call vote by district. Madam Clerk, would you please call the roll?
Joe Nevs,
Here.
Richard Valley,
Here.
Doug Verboon,
Here.
Craig Peterson.
Here.
Richard Fagundes.
Here. Okay, we have 5 present today. At this time, we'll move to the invocation and Pastor Andrew Cromwell from the Koinonia Church. Good morning.
Good morning, all. Just like to begin this morning just reading briefly a psalm or a portion of a psalm. Chapter 33 says, "We wait in hope for the Lord. He is our help and our shield. In him our hearts rejoice, for we trust in his holy name." If you would just bow your head and we'll begin today. Lord, we thank you today for your goodness. We do, in fact, invoke your name this morning, recognizing that you are the God of the universe. And we hope in you, Lord. We recognize that you are our hope and our shield. Thank you for the way that you have brought us through this last season of many challenges that have been a surprise, sometimes overwhelming. We thank you that you are with us no matter what. And we just acknowledge that you have never failed us. You've never left us or forsaken us. And so today we just cry out with our need once again for you. We're asking, Lord, for your help, that you would help us in the recovery economically very quickly to return as things get better and better. We are so grateful for that. But we're asking for a special blessing on our county, on our economy, on our farms, on each and every person within this county, Lord, that you would make us, we ask, the head and not the tail, that you'd give us favor beyond what we can reasonably expect on our own, beyond what we deserve. We're asking you, Lord, even for a late rain, that you would give us some water that we so desperately need. Now, Lord, for every board member, every supervisor, every department head, and every employee within the county, we're just asking today for strength, grace, wisdom, ability, health, Lord, that you would be our guide and that you would oversee all of this. We give it to you, and we pray this in your name. Amen.
Amen. Thank you, Pastor. If you now would please join me in the flag salute. Ready? Salute.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, this time we'll move to item 2, which is unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or any other items of interest to the public that is within the subject matter jurisdiction of the board. 2 minutes are allowed for each item. Madam Clerk? Okay, we have Lance Lippincott. Good morning, Lance.
Good morning, Mr. Chairman, board members, Lance Lippincott, Kings County Job Training Office, Kings County EDC. Just wanted to bring up to your attention that as of 2 weeks ago, the California Workforce Development Board declared that the Kings County Job Training Office and the Kings County Workforce Development Board is high performing. That classification, we've had it once before in 2016, 2017. It also comes with an award from the Governor's Discretionary Fund, just around $4,000. But it is something that's not awarded to every area, and there's certain performance guidelines that you have to hit. The best part about it is that Kings County continues to be considered high performing and keeps pushing the envelope. That's all. Thank you all.
Thank you, and congratulations to the staff and everyone else associated with your efforts. Further public comment?
I do not have anyone with their hands raised.
And no written.
No.
Okay, thank you. We'll move to item 3 then, which is approval of the minutes from the April 13, 2021 regular meeting. Board.
If there's no question or comments, I'll move approval April 13th, 2021, regular meeting.
Second.
So we have a motion by Verboen, second by Forgiveness. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboen,
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Very good. We have 5 in favor. Motion carries. We're on to item 4, which is the consent calendar. Board, what's your pleasure?
Move is presented.
Next, a second.
Okay, motion by Verboen, second by Nevs. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboen,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries. On to item 5, which is regular agenda items, and item A is the Human Services Agency.
Good morning, Chairman, members of the board. This is Sonia Bouguet, Human Services Agency Director, and I'm here with Monica Connor, Deputy Director over Child Welfare Services, and our District Attorney, Keith Fagundes, requesting your board's approval to approval of a resolution announcing April as a Child Abuse Prevention Awareness Month. Our Child Abuse Prevention Council has brought this resolution forward every year for the past decade or so. And during this past year, due to COVID, activities related to child abuse prevention have been tough to do. However, the staff in both the District Attorney's Office and our office, along with the community members, have continued the work of child abuse prevention and ensuring safety for kids. So Monica will share with you just a couple of little events that will be going on to mark April as our Child Abuse Prevention Month.
Yes, good morning, Chairman and members of the board. The Kings County District Attorney's Office and the Human Services Agency have partnered on the activities for Child Abuse Prevention Month. Brenda has pictures, a slideshow that she's going to pop up very quickly, just to give you a little bit of a sneak peek of some of the events. The first set of photos is the Paint Rocks for Prevention event. The DA's office and the Human Services Agency staff painted rocks that will be displayed outside of the multidisciplinary interview office at the District Attorney's Office. The rocks will also be used for a community scavenger hunt. Rocks will be displayed throughout Hanford, Corcoran, Lemoore, Avenel, and Stratford for the community to find. Brenda, the next picture, please. The second event is Wear the Blue Day on April 23rd to represent the blue ribbon for child abuse awareness. Everyone is encouraged to wear blue. The photo you see here is from a couple of years ago. The DA's office coordinated a Wear the Blue Day and invited local law enforcement agencies for this particular photo. Next slide, please, Brenda. The third photo is a traditional blue pinwheels for prevention. The pinwheels are set out along the walkways at the HSA buildings, and the DA's office is setting up planters displaying the blue shiny pinwheels. The use of the blue pinwheel to represent child abuse prevention efforts was defined in 2008. Prevention Child Abuse America introduced the pinwheel as a new national symbol for child abuse prevention. Why? Because by its very nature, the pinwheel represents playfulness, joy, and childhood. It has come to serve as a physical reminder of the great childhoods we want for all children. Thank you. We have Keith. Keith, would you like to say a few words?
Yes, thank you for that. And it's a pleasure to partner with the Human Services Agency as well as every agency in the county to protect children. This month is Child Abuse Awareness Month. And the theme is strong as a rock. And when it's obvious when a theme is like that you come up with a rock painting process. And it's pretty monumental to see the staff and their families and other visitors to our office express themselves in the way in which they painted the rock and the emblems that they put on them. So we are also will be displaying these rocks on the evening of April 14th when we did the display for the autism awareness event. And so we had a lot of the community also paint some of these rocks, and it was pretty refreshing to see the community show up at that event that Hanford PD sponsored, and to get involved in not only the autism awareness event, but also now the child abuse awareness event. And we're proud to partner with Human Services and to sponsor several events this month to raise awareness. And as you know, this being Victims' Rights Month as well, next week we will have several victims' rights events that will be happening, and a display the quilt. So again, we're happy and to partner up with Human Services Agency, and we love the partnership. So with that, we invite everybody to participate in these events and to be strong as a rock during this whole week and month.
Great. Thank you. And thank you all for the presentation today. And, you know, as we continue to emerge from COVID-19 and try to enter back into the, our normal, more focused efforts outside of COVID-19. And these are always issues that kind of live in the shadows and have been really, highlighted in these challenging times. And so truly hope everybody pays close attention to this and reconnects with the challenges of our time. And this is one of them. So at this point, I'd bring it back to the board for action.
Approval. I'll second that.
Okay, we have a motion by Fagundes, second by Verboen. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboen,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries. We'll move to item 5B, which is public health.
Morning, Mr. Chairman, members of the board, Ed Hill, Public Health. I'm going to go ahead and turn this presentation over to Lalo Legaspi, the program manager who's in charge of this program. He's going to give an overview of the program, the work that they've been doing, as well as a small presentation from one of our partners, the California Health Collaborative. Lalo?
Good morning, Mr. Chairman and members of the board. Everardo Legaspi from Public Health. Today, I bring forward the agenda item regarding the retroactive contracts for the Adverse Childhood Experiences Aware Program, also referred to as ACEs Aware Kings Collaboration. Also on the call today is Linda Baggio, Program Manager from the California Health Collaborative. ACEs Aware Kings Collaboration, with funding from ACEs Aware, is a collaboration between the Kings County Department of Public Health, the California Health Collaborative, Kings Partnership for Prevention, and Kings United Way. This partnership has led to a high-quality, impactful, and far-reaching initiative that has leveraged the combined experience, expertise, and networks of each of the partners to raise awareness about ACEs in Kings County. The term Adverse Childhood Experiences, ACEs, comes from the landmark 1998 study by the Centers for Disease Control and Prevention and Kaiser Permanente. The ACEs Aware Initiative was created in partnership between the Department of Healthcare Services and the Office of the California Surgeon General as part of the Governor's California for All initiative. The mission of ACEs Aware is to change and save lives by helping providers understand the importance of screening for adverse childhood experiences and training providers to respond with trauma-informed care to mitigate the health impacts of toxic stress. ACEs include 10 categories of adversities in 3 domains experienced by age 18. Abuse in the form of physical, emotional, or sexual. Neglect in the forms of physical or emotional. Household dysfunctions in the forms of parental incarceration, mental illness, substance use, parental separation or divorce, and intimate partner violence. The California Surgeon General has set a bold goal to cut ACEs in half in 1 generation. Under this grant, we were awarded to service the community and under 4 main objectives. Develop and provide certified clinical and non-clinical supplemental trainings, network of care engagement activities, peer-to-peer engagement events, and a communications component. The certified provider clinical and non-clinical supplemental trainings developed received approval from the California Surgeon General, Dr. Nadine Burke-Harris, and several training events have been held and additional opportunities are planned for the future. These trainings not only cover an overview of ACEs, they also go into depth regarding toxic stress, social determinants of health, resiliency, the PRO screening tool, and what it means to be trauma informed. Additionally, our clinical trainings offer AMA, PRA Category 1 credits, TM and ANCC, CBRN, APA, AAPA, and ASWB continuing education credits. The network of care engagement events allow for various types of providers to engage in meaningful guided conversations regarding how to better collaborate to address the whole patient including ACEs. The peer-to-peer engagement events provide a venue for medical providers to share experience and practices that lead to better health outcomes by providing trauma-informed care and focusing on patient resiliency. The communications component has allowed for the establishing of the ACEs Aware Kings Collaboration website hosted by KPFP, Kings County ACEs Aware Connection site, and numerous social media blogs and posts. Additionally, the collaboration is in the process of developing a toolkit for the Kings County community that will encourage a continuity of this work for years to come. ACEs Aware recommends connecting patients to a network of care that supports the treatment of toxic stress through the evidence-based interventions for mitigating toxic stress. Under the ACEs Aware grant, our collaboration has worked to launch the Kings Referral Exchange System, which serves as a database for providers that enables them to send referrals to other organizations on the platform and connect clients to appropriate resources that help reduce toxic stress. Linda will now share additional details regarding the progress of grant activities, recent accomplishments, and what's next for the ACEs Aware Kings collaboration.
Thank you so much, Lalo. Hello, everyone. My name is Linda Baggio, and I am the program manager with California Health Collaborative. Lalo provided a brief overview to our current ACEs Aware grant and objectives supported within our project. I would like to expand our discussion by providing additional details on our implementation, best practices, and recognition to this rewarding work. Under our monthly network of care engagement event, we have established a network that consists of 56 active participating members from various organizations in Central Valley and throughout California. To name a few, key stakeholders and community leaders in active participation with our network of care include First Five, Los Angeles County Department of Public Health, Tulare County Health Human Services Administration, Kauai Delta Healthcare, Omni Family Health, Valley Children's Healthcare, WestCare, HealthNet, Aetna, and California National Guard Counter Drug Task Force. Over the past 7 months, under a multi-agency collaboration, we have worked to establish a robust network of care that is leading screening and referral efforts here in Kings County through the collaboration of health and community service organizations. Till date, we have held 7 network of care sessions with representation from 51 different organizations. We value the power of community in pushing this work forward. With additional funding secured by CHC from ACEs Aware, we aim to expand the efforts initiated by Grant 1. We understand that this is a crucial project. Therefore, all partners are working arm in arm and side by side to create a process for lifelong implementation to support this work. ACEs Aware Kings collaboration has been recognized across the state for its role in this work. We have received recognition for our efforts in engaging our community through virtually despite COVID-19 adjustments, through our development of ACEs Aware welcome boxes. The boxes we provided an inspiration to our community to be a part of this work, and to date has been distributed to 128 attendees over time. This welcome box has impacted change and is now being adopted across grantees. We're currently working to develop an ACEs Aware Community Resource Toolkit that will be packaged and distributed to all Kings County organizations who have pledged to support this work. Within our monthly peer-to-peer engagement event, we have hosted 5 provider sessions, have identified medical partners who are currently working with us to share our provider training and resource to providers in the district. These providers understand the value of resources offered through this project. Therefore, they are currently developing policies to include our recorded events in their e-learning website for training of their medical residents and current provider staff. The value of our work is recognized across counties and has helped to improve shared resources, enhance integration, and continuum of care. We have hosted 5 peer-to-peer sessions on understanding the value and implementing additional sessions with the goal of providing evidence-based resources and supports to providers who are actively screening to prevent, treat, and heal the harmful consequences of toxic stress. Under our provider training objective, our team has worked to create a clinical and non-clinical training that is tailored to Kings County. Both trainings received approval from the California Surgeon General, Dr. Naveen Burke-Harris, for implementation to increase screening efforts to address the impacts of toxic stress. 29 grantees were awarded to implement the provider trainings throughout California. ACEs Aware Kings Collaboration is one of very few organizations who have received approval for our trainings. It is my pleasure to also inform you that our provider trainings has been uploaded on the ACEs Aware website. This is a great deal to our team as we are the first grantee to have their trainings posted on the ACEs Aware website. We are also working to launch both provider trainings in a continuous learning webpage, which will allow us to extend our training resources statewide to providers who may not have the capacity to join us due to current demands as a result of recent public health crisis. Finally, our communication grant allows the distribution of marketing materials in addition to the final development of the King's Referral Exchange System. The King's Referral Exchange System offers an integration of health and community services, built-in screening such as the ACE scanner, and seamless reporting, which makes the referral exchange a versatile tool to support our organizations and our communities. 31 organizations have been integrated into the King's Referral Exchange, and to name a few, these include Kaiser Permanente, First Five, Fresno, NAMI, Omnia, ARIA, and others have joined us to become a network of partners with shared language. On 3/25, ACEs Aware Kings Collaboration was informed that we have been selected by ACEs Aware to be recognized for our work in Kings County. It brings me such great joy to see the hard work of our multi-agency collaboration receive recognition, in addition to being invited by Dr. Naveen Burke-Harris, the Surgeon General, and their entire grantee team on the outstanding development of ACEs awareness in Kings County. This is a great deal to us, and we take this recognition very seriously. Out of 117 grantees, we are 1 out of 9 grantees who have been invited to be highlighted for our work. This highlight recognizes our outstanding efforts in utilizing grant funds to establish a unified collaboration. We are being recognized for efforts with increasing community response to our communications, clinical and non-clinical supplemental trainings, and our network of care sessions. The ACEs Aware and a rural health team thereby wishes to learn from our strategies for implementation in hopes that we will inspire other grantees. I feel so extremely blessed to be a part of this work. My life and the life of those who learn about ACEs Aware Kings project has been positively impacted. I am honored to work alongside with the Kings County Department of Public Health to carry out this essential service in our community. Thank you.
Thank you, Linda. Mr. Chairman and members of the board, in regards to the fiscal impact, there is no impact to the general fund associated with the recommended actions. The recommended agreements with the California Health Collaborative in the amount of $195,002, with the King's Partnership for Prevention in the amount of $62,000, and with Kings United Way in the amount of $64,678, are currently budgeted in budget unit 419600, the Health Department Grant Program, account 92047, Contractual Services, and is fully budgeted in the approved Adverse Childhood Experiences Aware Grant. Therefore, it is recommended your board consider approving an agreement in the amount of $195,002 with the California Health Collaborative for Adverse Childhood Experiences Aware Program related activities, retroactively effective from August 5th, 2020 to June 29, 2021. Consider approving an agreement in the amount of $62,000 with the King's Partnership for Prevention for Adverse Childhood Experiences Aware Program related activities, retroactively effective from August 5th, 2020 to June 29, 2021. Consider approving an agreement in the amount of $64,678 with Kings United Way for Adverse Childhood Experiences Aware Program related activities, retroactively effective from August 5th, 2020 to June 29, 2021. And delegate authority to the Director of Public Health to modify these agreements as necessary for program implementation, so as long as the changes are only ministerial without requiring further board approval. This concludes our report, and we are happy to answer any questions.
Very good. Thank you. Okay, this time, bring it back to board. Questions, comments?
If there's no question or comments, I move approval and thank you for a presentation and keep up the good work. Move.
Very good. So we have a motion by Verboen, second by Fagundes. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries. Right, let's see, at this time, we'll move to item 5C, which is Public Works, and Dominic Taberski.
Good morning, Mr. Chairman, members of the board. Can you hear me?
Yes, sir.
All right, very good. I am before you this morning to request approval of change order number 2 for the Kings County Sheriff's Operations Building Site Improvement Project and authorize Public Works Director to sign the change order. The Sheriff's Operations Building, currently under construction between the Kings County Jail and the Day Reporting Center on Kings County Drive, will house sheriff staff, which is currently adjacent to the old jail on Lacey Boulevard. The project was bid as 2 separate contracts, one for the site improvements and one for the modular building itself. The bid documents for the modular building did not define the foundation type and design such that the modular building fabricators could propose a foundation best suited for their product. This kept the field of potential bidders broad, and of course, defining the foundation type would have had the opposite effect. Because of this approach, the building site improvement contract did not account for the foundation efforts, which has now necessitated this change order. Please note this is change order number 2, as the Public Works Director approved change order number 1, which was within the allowable 10% of the original contract amount, which included utility adjustment and replacement and the addition of a post indicator fire valve. Change order number 2 is $40,000. When combined with the $27,000 change order number 1, brings the project total to $648,000. And that, again, is just for the site development, does not include the building itself. Construction is currently underway and is anticipated to be completed by the end of February 2022. And I'd be happy to try to answer any questions.
Very good, thank you. So back to the board for questions.
So move. For Joe, he don't like to. 40,000.
And this is the second one already, just to
I know.
move dirt.
They just started 2 days ago.
Yeah.
So Dominic, on the change order,
Yes.
so when we go out for bid, I mean, they missed this change order in the application, but it doesn't go outside the realm of being changing the original bid from somebody else that might have had it in there?
Well, no, so because we separated the contract, one for the modular building itself and one for the site improvements, we didn't want to define the foundation type, because by doing that, we would have limited our pool of bidders for the modular building. Some modular building fabricators use a certain type of foundation, others use a different type. And so we didn't want to narrow that field. So we purposely left that open. Now that we've settled on the JTS as the fabricator for the building, and we know which foundation type they're going to utilize, that caused some additional work on the site of, on the portion of the site development contractor. So it was somewhat anticipated, but until we had both groups under contract, we really didn't know which direction we were going to go in.
I understand. I'll second that motion.
Okay. Thank you.
Very good. Okay, so we have a motion by Fagundes, second by Verboen. Madam Clerk, please call roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries. So this time we'll move now to item 5D, which is administration, and Ms. Campbell.
Yes, thank you, Mr. Chairman. Good morning, members of the board. Rebecca Campbell, County Administrative Officer. This is a weekly update on the status of the COVID-19 pandemic. The last update was given to your board on April 13th of 2021. Looking at state actions this past week, wanted to bring to your board's attention that Senate Bill 86 was signed by the governor. This budget trailer bill contains technical cleanup language to the Golden State Stimulus Program, allowing the program to be implemented in a manner that ensures that in social safety net programs receive benefits for which they are eligible. The governor also signed Senate Bill 93. That is a budget trailer bill that seeks to implement rehiring rights for hotel, airport, and building industry workers who were laid off for reasons related to the COVID-19 pandemic. The governor had vetoed a similar measure in year 2020, but SB 93 is narrower and contains language to make its provisions specific to the COVID-19 pandemic and establishing a sunset date of December 31 of 2024. There was quite a bit of activity with the Senate, along with Senate Budget Chair and Budget Subcommittee chairs. They presented a Build Back Boldly budget priorities this past week. And so there were a number of specific proposals outlined in their plan related to post-pandemic economic prosperity for all Californians. There was a lot of activity focused around the state budget, but I won't call out unless they are related to COVID-19. So now moving to the federal side, wanted to let your board know that we're seeing a bit more activity from the U.S. Treasury regarding new guidance for the Coronavirus State and Local Relief Fund, which was put into place by the American Recovery Act plan. So the U.S. Treasury Department did announce steps eligible for counties and cities to take and receive the direct payments. I did ensure that our Department of Finance did implement those measures, and so we are ready to receive the funds. And we are still awaiting guidance from the Department of Treasury. On the county side, the Emergency Operations Center did meet this past week, and we'll be reducing those meetings on a weekly basis. The county did open its lobbies this past week, and so we are moving forward as the economy moves forward. So with that, I will turn it over to Director of Public Health, Mr. Ed Hill.
Good morning, Mr. Chairman, members of the board. Ed Hill, Public Health. I'd like to start off my report, as I always do, by reminding everyone the simple steps we can all take to protect ourselves from communicable diseases such as COVID-19, which are frequently wash your hands for 20 seconds or more. Don't touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell. Stay home if you are sick and wear a cloth face covering to protect yourself and loved ones. Our current numbers in the county, we've collected 212,923 samples. We currently have 278 results pending. We're currently monitoring 3,497 individuals. Our current total cases since the outbreak began is at 15,571, unfortunately with 227 deaths. We do have 11,848 closed cases, bringing our open case total to 3,496. Our skilled nursing facility outbreaks have not changed at all, which is a good sign. Since the outbreak began, they've had 311 cases. They currently have 0 open cases, 269 closed cases, and unfortunately 42 deaths. Prison outbreaks, again, much like the skilled nursing facilities, have remained stable. There's not been much change at all. Their total current cases since the outbreak began is 7,664. They've collected 127,859 samples. They have 32 results pending. Their open case count is at 1. Their closed cases is at 7,645, and unfortunately at 18 deaths. We continue to watch hospital data on a daily basis, and we continue to see a decrease in med-surg or general admissions as well as ICU admissions. As of 4/18, the local hospital had 4 COVID patients on the med-surg or general floor and 0 patients in the intensive care unit. Our status for PPE has not changed, and we're still maintaining that 60-day supply for all of our medical facilities. Our mobile testing program site schedule is on our website. I'm still waiting for an answer from the Unified Support Team on the testing expansion with municipalities. Our current metrics for the blueprint are our new cases per 100,000 is at 2.1. That's our adjusted rate, down from 2.6, which is our unadjusted rate. We did see a small increase in cases over the last week, a couple days where we returned into double digits. That's due to the Easter weekend that I warned about last week. It's the 2-week period after that weekend, so we are starting to see those cases emerge now. Our overall testing positivity is at 0.7%, and our testing positivity in the lowest quartile for the Healthy Places Index has also decreased to 0.7%. So this means our new cases per 100,000 meets the orange tier criteria, and our testing positivity both meet the yellow tier criteria. Our tests per 100,000 has increased back up to 418, which is a good sign, meaning that we are maintaining our testing. And as a result of these new numbers, we will be moving to the orange tier tomorrow after the numbers have been posted by the state. We've drafted a press release. We'll be releasing that shortly after this meeting. This change that happens tomorrow, some of the highlights, gyms and fitness centers will be allowed to increase capacity to 25%. Hotel and lodging will also be able to increase their in-home or their in-house fitness centers and capacity in their pools. Movies and theaters can increase to 50% capacity or 200 people, whichever is fewer. Museums and aquariums will be able to increase indoor activities to 50% capacity. Restaurants will be able to open or increase their capacity up to 50% or 200 people, whichever is fewer. Shopping centers will be allowed to increase their food court capacity to 50% or 200, whichever is fewer. One of the bigger changes, bars, breweries, and distilleries now can open outdoors with modifications. And family entertainment centers can also open indoors with modifications and 25% capacity. Additional changes to the blueprint that were announced last week. California ended all location and capacity limits on places of worship and modified gathering guidance in response to a recent judicial ruling. The capacity limits on places of worship are now strongly recommended according to CDPH. They also changed movement to a more restrictive tier. Will now be new cases per 100,000 and testing positivity in the more restrictive tier. That is being changed to, instead of new cases per 100,000 and testing positivity, it's changing to new cases per 100,000 or testing positivity, which means in the past, if either one of those categories met the more restrictive tier criteria, they would move a county. Now it's if either one of them, it's essentially less restrictive. In other words, it's not going to bind us by both. It's if one doesn't meet the criteria, then they won't move us to a more restrictive tier. Also, as everybody knows, the state also announced after June 15th, the state will move what's known to be, or what's been known to be called beyond the blueprint, and we'll see those actions start to take place. But the state did indicate, or the California Department of Public Health did indicate that they would be bringing back those measures and processes that were in place before movement to the blueprint, which are watch lists, things along those natures. And if they start to see increases in cases or hospitalizations, and there's no projected downturn, that they will start having discussions with local counties and providing assistance and aid. On a vaccine update, on Wednesday, April 7th, 2021, we expanded the eligibility to all those over 16 years and older. We did this because we weren't seeing a very high demand in vaccine appointments. We were hoping that this would increase our appointment demand. It did slightly, but it didn't have the desired effect. Last week, Public Health administered 2012 vaccines. We no longer have any visibility into what our OptumServe site or the state site is giving on a daily basis, so I'm only reporting our numbers. We do have plenty of available appointments in all of our clinics. We do have the capacity to provide 700 doses a day. And then, as mentioned, we did expand our eligibility 2 weeks before the state moved to the 16 and older. And just as a reminder, 16 and older is only for the Pfizer vaccine, and both the Moderna and the Johnson & Johnson are 18 and older. Last week, we were approached by the state due to the amount of vaccine that we have in our inventory, and we discussed that inventory, future allocations, and our current throughput or vaccinations being administered. This call has been happening across the state, and the state is seeking to move vaccine in areas of higher demand. We currently do have a pretty good on-hand inventory, and in our discussions with the state, we came up with 3 options. One would be to move the OptumServe state vaccine site to another county along with their allocations. This would make the most sense since it is only available in Hanford, and we have plenty of vaccine coverage in Hanford. Option 2 would be stopping or slowing our allocations moving forward so that we can use some of our on-hand inventory. Again, this would be a good option as the logistics that are and the challenges associated with moving vaccines. It would be just easier for us to just keep the vaccine on hand. And then finally, the last one was if we were asked to return some of our on-hand inventory, we suggested returning mostly the Moderna because it seems to be the least favorite of the vaccines for our constituents. So far, there's been 55,041 vaccines administered to Kings County residents. Also last week, the feds, states, and county paused the administration of the Johnson & Johnson vaccine out of an abundance of caution due to reports of 6 cases of rare blood clot in the U.S. There has been no known cases in California, and we have administered over 4,000 doses in Kings County. We have not seen a case. The last update we have on this is that the update would probably be about 2 weeks out before we hear anything about this vaccine status. The state did add an addendum to the activity and business tiers chart to provide businesses with opportunities to adopt higher capacities when and where all guests have been vaccinated or tested, in addition to physical distancing not required in sections where all guests are fully vaccinated. That concludes my report. I'm happy to answer any questions.
Very good. Thank you. At this time, we'll bring it back to board for questions, comments.
Yes, Mr. Chair, if I could be recognized.
Yes, sir.
Thank you. So I got a few questions here. Thanks for your patience. Hey, Mr. Hill. So the request will come from the state where the discussion's already taken place in regards to reallocating or taking our vaccines out of Kings County and sending them to other areas in the state. If that were to happen today, based on the numbers, on the data, on how many people have been vaccinated in Kings County, and as much as we all want to get back to normal, are our numbers at a point right now where we could be back to normal? And if not, how much more of a increase do we need based on your judgment, more residents to be vaccinated in the county of Kings for us to be able to have this return to normal we want, but making it a reality and backed up by the number of people vaccinated, not just a wish?
Thank you, Supervisor Valley, through the chair. I'll try and address your question to the best of my knowledge at hand. The biggest question on the return to normal would be to reach the herd immunity, as you know, is somewhere in the neighborhood of 75%. So that would be a combination of vaccinated individuals as well as individuals that have had the virus and then have some immunity to it based on their own internal immune systems. The issue we face there is we don't have a good number of how many people have actually been impacted or have had the virus because of the asymptomatic individuals. So it's really not a great number to go by. Right now, I think our vaccination numbers, I'm sorry, I'm trying to pull them up as I work towards the answer, but we're right now at about 29% vaccine administration in the county. So we would like to see that get much higher, at least of 50%.
Okay. Is there a blanket number or percentage that the state uses for you to be able to make your best guess on those who've had it and recovered to add them into that herd immunity percentage?
Not that I'm aware of. I can have our EPI team pull that data and have it for you for the next meeting.
Based on the data that you have, Mr. Hill, and I know it's limited, would you say that we're there yet?
I say that we have some ways to go, especially when it comes to vaccine administration and distribution.
What, Mr. Hill, what can the board do to be more supportive. What could we do as leaders in the county to help us get to that increase? I know we've been pushing for several months now. But is it time to double down on the efforts within any jurisdiction of the Board of Supervisors?
So I would ask that the board continue to support the message of the importance of the vaccine and us reaching that herd immunity so that we don't slip back into an area where we are forced or have to look at being included on the watch list. I would also ask the board to continue to support the message of frequent and common testing. Kings County remains one of the highest testing counties in the state. We're very proud of that. In fact, we just received another request from another county today on how we are keeping our testing numbers so high today. That's from all of the board efforts, the work with the schools, all of the processes that we put in place. On the vaccine front, the message needs to be continued that they are an important part of reaching that herd immunity, and it's an important part of protecting all of our loved ones in the county.
Is there anything fiscally that that we could do that would help you with any of that?
At this time, I would say no. With the emergence of the ELC, or the Epidemiological Lab Capacity Grant Program that we brought to your board last week, we have funds in there now, and they are expanding that. In addition to that, we will likely be awarded an additional set of funds from the immunization branch to increase that and provide incentives for vaccine. So I think between those two programs and the help from the board and our partners throughout the county, our community-based organizations, our other FQHCs and other facilities, I think really just driving home the message and using those incentives to our advantage.
Thank you, Mr. Hill. I know this is probably just a board decision, but your opinion, are we at a point right now, Mr. Hill, where the board could or should take up the discussion on bringing back members of the public, whether it's in a limited capacity, members of county staff, the department heads, and of course, any board member that chooses to be in the chambers physically? Are we at that point where we could have that discussion safely?
And I think that would be a discussion between not only the board, but county risk management, county council, in that realm, so that it's an agreed upon approach for the entire perspective of the county.
I agree with that. And Mr. Chairman, I'm going to transition real quick and then I'll wrap up. Thank you, Mr. Hill. My questions to the county CAO, Ms. Campbell, you confused me a little bit when you said that in regards to the EOC meetings, the phone calls, that they were going to be limited. But I believe that we were told yesterday by the fire chief that yesterday was our last conference call. So can you clarify?
Sure, Supervisor Valley. He did say that it would be the last call for now, but he will convene the EOC as needed. That is what I understood.
Okay. I guess that announcement caught me by surprise yesterday, and I know that's a call on the director. I believe Supervisor Neves can make that call on his own. If not, then I apologize for being incorrect there. But in this regard, since this has been going on for a year now, we've been having these, the phone calls and having, the people that we need placed on that call from around the county as we've been trying to work through this pandemic. I was of the belief that would be a topic of discussion at the Board of Supervisors so we can talk about if in fact it's time to stop with those efforts. Because if it is time to stop with those efforts, then I believe there's a number of things that we should discuss, including opening the chambers back up to the public and allowing more participation into the county level there. So, Mr. Chairman, is that something that you believe the board feels we should have that discussion amongst ourselves? Because that's a very important decision to make and just to pull the plug on during the pandemic. That's my question to the board, whether we can entertain that discussion or not.
Well, sure. And I would maybe redirect to county council to maybe explain if she has that knowledge on the emergency systems, the EOS and its responsibilities and leadership in this time and how that plays back into board decisions with respect to that operation. And
the Emergency Operations Committee is an entity under the authority of the County Board of Supervisors. The county has chosen to delegate responsibility for managing that committee to the Director of Emergency Services, whom the board has appointed, Supervisor Neves. He is the Director of Emergency Services. The committee has been meeting since March of last year on a weekly basis, with some instances of interim meetings on weeks when there were emergency or emergent events that needed to be addressed. I am unaware whether the decision yesterday to terminate regular meetings of the EOC was at the direction of the Director of Emergency Services or if it was a vote of the committee. But it clearly is a decision that even the Director of Emergency Services operating under delegated authority from the board could be overturned by a majority board vote.
okay, thank you. And I guess, the other kind of obvious discussions that, I mean, we are getting regular reports. I haven't heard Mr. Hill say that he's not going to be reporting on COVID-19, which, there's probably some deeper drills on the EOC calls that we take or we consume, but the most driving factors of positive cases and recovered cases and vaccine application throughout the county, we're still getting those, and I think I hope it's the intent of Mr. Hill and Ms. Campbell to continue that, because those are important numbers. But the other obvious challenge here, and I've had numerous discussions with residents throughout our community, is there are just a lot of folks that are very hesitant to take the vaccine, and they felt like the ones that I talked to were just, they want to wait and see. It's not that they don't want to take it, but they want to wait and see. And I think they have, everyone has their reasons. I mean, I took the J&J shot. I also have a blood disorder that makes me more apt to have a blood clot. I take medication to offset that, and obviously the J&J announcement, concerns me a little bit. But I think at this point, it again, it's kind of like the testing thing. I mean, people are either going to get tested or they're not, and it becomes a personal choice at that moment. So rather than be long-winded here, okay, we also have a comment by our fire chief. So, Chief, please go ahead.
Yeah, Mr. Chairman, thank you very much. Just to clarify what took place yesterday, we're not shutting down the EOC. What we're doing is just discontinuing the monthly or the weekly Monday calls. The information as it goes out continues to go out. We're working in the EOC with the branches or divisions that have to be open during the pandemic. But our Monday calls were getting rather short. There wasn't a lot of input, a lot of exchanges of information. Mr. Hill provided most of the information, to the board on Tuesdays. But again, we are keeping that option open should any additional information or things that we feel the group needs to know. We're keeping that open. So we're not completely discontinuing the Monday calls. We're only going to do it on information as it comes in and as needed. And I spoke with the director on this, and we both felt it was the right thing to do. But we are not shutting down the EOC. The EOC is still open and still operating. So hopefully that helps. Thank you.
Mr. Chairman?
Yes, sir.
Yes, Mr. Chairman. I appreciate a little bit more of a detailed answer there, mostly for the public. The reasoning that we got for the cancellation of the meeting yesterday, and that's the words that were used, that we just weren't going to have another call, was what was concerning to me. And for based on the lack of participation or the lack of anyone having anything to present. And I always thought if we got to that case at that level, then that meant we were in the all clear sign here. And so again, that was my reasoning for bringing that to the board. If I believe the board should be made aware of why we're turning down that level there. Whether anyone's talking or not, besides Mr. Hill, that's a once a week opportunity where we have Corcoran on the line, Avenal on the line, representatives from the different cities, Hanford and Lemoore, and that's the ability to interact and share that information countywide in response to this pandemic. And so I am concerned still that we're toning that down, unless Mr. Hill said, we were good to go to turn that down. So I appreciate, the board taking the time off. And I just have one last thing going back to our CAO. There was a media story that came out on Wednesday, and it came out in the Sacramento Bee. And then the Fresno Bee picked the story up on Sunday, and it was a very troubling news story. And it's troubling from the fact that, people were reaching out and asking about the topic of the story. And one, I wasn't made aware that this story was coming out. I don't know if the board was made aware of it. I believe we should have been. If you have a reporter from the Sacramento Bee calling on something as major of the topic of that story was. And so the things to read in that story were troubling, but also was troubling was the fact that, it said Kings County officials did not respond for comment on there. So I wanted to ask the CAO publicly what happened there. I'd like to know, how that story came about as far as who was contacted for comment. And I'd like to know why the board wasn't made aware of it, meaning it's not fair for us to wake up and read a story on the front page of the Sacramento Bee that is hitting our county negatively when the people in the county are reading that too. And for the Fresno Bee to pick up on that story and run it Sunday was more of a local hit and just started the disappointment all over again. So I believe the board deserves some kind of update or response to that on how that happened. Thank you, Mr. Chairman.
Okay, yes, thank you, Supervisor Valley. Yes, we did receive an inquiry from the Sacramento Bee. We were researching the information that they were presenting to us, and unfortunately, they did publish before we could get back to them. So I apologize for that, but we were seeking to help the paper out to answer their questions. We have received dozens of inquiries from media outlets, and we have responded. But this one, they just published before we could get back to them.
What is that material? What is the information that you pulled together? And is that something you should send out to the board? I'd like to follow up on that because now I got to follow up to people who are concerned about reading that story.
Okay, this was regarding some information that was put out through UC Merced. So I will have to get back with our health department to gather more information on what they didn't give us what they had presented. So we were trying to figure that out. And so we were looking into more details so we could have accurate information. And so we can circle back with you, Supervisor, and talk about that some more.
Did the Sacramento Bee give you a deadline?
I'm not so sure about the deadline, so I can get back with you on that as well.
Okay, that's okay. All I can ask for is that if oh, can you answer my question? Did you notify the board on the possibility of this story coming down the pipe?
No, I did not. I did not notify the board. I'm trying to think back to last week. I didn't notify until I had heard about it later on in the week, and I believe I did speak to the chairman about it in our weekly meeting. I'm pretty sure we did talk about that.
Okay, on something like that though, and I know I've asked this before, can you update the whole board? I know the chairman gets a courtesy and I could appreciate that. I'm a chain of command guy myself. That being said, you know, the rest of us four, we're all on the same level. We have the same responsibilities back to the people of the county. And, you know, this is a story for those who are unaware, where the Sacramento Bee said Kings County was ground zero for deaths among Latino immigrants during the COVID pandemic. And to me, that's something that's hard to wake up in the morning and have people reading about, especially to read that the county didn't have a response to that or didn't respond for comment. So can you please make sure that we're all updated as a courtesy as well?
Yeah. I would, for a second here, Ed Hill has his hand up and would like to speak. So if we're willing to, I would also remind the board, we have a 10 o'clock public hearing. So if this is going to go on too long, maybe we should recess this discussion and yeah, we could recess that discussion, handle the public hearing, and then come back to this. If that's, if the board's okay with that.
It would be.
Yep. Okay. So we'll move to our 10 a.m. public hearing at this time with the Community Service Agency and Greg Gatzka, Alex Hernandez. Mr. Gatzka.
Good morning, Mr. Chair, members of the board. This is Alex Hernandez, Community Development. Can you guys hear me?
Yes, sir.
Okay, great. So the county received an in lieu parcel map application known as IPM 20-04 that will adjust the property boundary lines between two existing parcels and create a third parcel as a farm home retention. The property is located on the northeast corner of 19th and Laurel Avenue. One parcel is currently under Williamson Act contract, while the other parcel is not, which requires the contract to be revised. To accomplish this, a rescission of the existing land conservation Williamson Act contract is necessary, and simultaneously entering into a new contract that reflects the new adjusted property boundaries. The new contract acreage will retain the same as the previous contract acreage, which is 159 acres. The Division 1 of the Kings County Advisory Agency approved this land division on October 23rd, 2020, subject to the revision of the Williamson Act contract. Rescission and simultaneously entering into a new Williamson Act contract requires Board of Supervisors approval and certain findings to be made by resolution. So staff's recommendation is that your board conduct a public hearing and adopt the attached resolution, which will find that the rescission and creation of land conservation contract is categorically exempt from environmental review under the California Environmental Quality Act, Section 15317. Rescind Williamson Act contract number 214 and simultaneously enter into a new land conservation contract number 2096 and authorize the chairman of the board to sign the contract on behalf of the county, make certain findings pertaining to the California Government Code Section 51257, and direct the Community Development Agency to complete the administrative requirements, recordings, and make the required notices to property owners, county departments, and state agencies. So that kind of concludes my staff report. If there's any questions, I'd be happy to answer those.
Very good. Thank you. Questions from the board? Okay, seeing none, we will move to the public hearing at this time. So at this time, we'll open the public hearing. And Madam Clerk, do we have anyone that has either provided written or wishes to speak on the item?
I have no hands raised and no written comments.
Okay, very good. So at this time, we'll close the public hearing and bring it back to the board for deliberations.
There are no questions or comments, Mr. Chair. Move for adoption as presented by staff. Second.
Okay, we have a motion by Neves, second by Fagundes. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries. And so at this time, we'll return back to our discussion on the COVID item and the media issue. And Director Hill had his hand raised and would like to speak. So Director Hill, please.
Yeah, thank you, Mr. Chairman. I just wanted to provide a little bit of clarification. The reporter that reached out to us stated that they had data from UC Merced and they wanted our response to that. Of course, not knowing what data they were referring to, we inquired as to what that data was, and then we didn't get a response. They did provide us with a deadline for their story. I can't remember what it is off the top of my head, and I'm trying to search through emails to see if I can locate that. But that, I believe, answers two of Supervisor Valley's questions.
Yeah, Mr. Chair, I appreciate Mr. Hill being public. We did talk the morning that the story came out, and then we talked again on Monday. I didn't want to bother him on Sunday when the Fresno Bee picked it up and ran the same exact story from the SAC-B. So I appreciate the information he was upfront about on Wednesday with me. That being said, I think it, the board needed to get an update here publicly in response to it because whatever we have to say about that story and that situation right now are the people we're responsible to. All they know at this point is what they read in the story. And they haven't heard back from us in this discussion here today, as limited as we are publicly online right now, that, this isn't an official response to that story, just having this conversation. So that's, it's a big deal. They're talking about farm workers, and there's a lot of people here that care about them. And that's a tough story right there. So I'm gonna leave it right there, Mr. Chairman. Thank you and the board for giving me the time this morning. Thank you.
Yeah, thank you, Supervisor Rowley, and I agree. I think there's obviously another side to this story. When you look at how this came down, how the county responded. I think we responded, as any county would respond in a pandemic and trying to meet the needs of the community. And I just look back on, things like our CARES Act funding being held up by the governor. Here we are now with, something like a drought, an impending drought. The federal government has acted, designating, our region as a drought impacted region, and the governor hasn't done that. And so I think there's a lot of this story that I think from our aspect was responsive and we didn't get to tell that, so that's okay. We know the true story, and we can share that in the future. So,
Mr. Chair, I would seek clarification from the board. We are currently receiving approximately anywhere from 3 or more or less inquiries from the press per week. I would ask your board, does your board want an update on every inquiry that we receive, and how would you like that update?
I would, yes, I would turn that back to the board. I think,
If I could, that's a chair's job. You run it through the chair. And if he feels a need to get it out to the people, whether it's I'm the chair or Supervisor Peterson or Neves or Valley, the chair's responsibility. If they get the extra money for it, let it be their responsibility to get it to us. And Let them be the chair, let them be in charge for the year.
Comments, Supervisor Alley?
I would just say independently that if the CAO feels, it would be my hopes that if the CAO felt a topic was that warranted to bring the chairman's attention, that on the CAO's own discretion and judgment, to be able to, as she has on other issues, simply send out the email. I mean, asking for a motion here is, to me, just trying to be difficult. It's a simple request. I don't think any board member wants to wake up to Sacramento Bee story that ran on the Rough and Tumble website, which is a main website that all the senators, assembly members, and their staffs and chief of staffs read every morning, and have our county on Front Street like that, with board members waking up to zero heads up. So to me, a CAO shouldn't need a motion for that. They should just say, this is something that's coming down, a 5-second email to the board, and we're aware. And if we want to follow up, then we could call her. It's that simple.
Yeah, and I mean, in this case, I think, whether we shared the discussion or not, but I guess my decision, in cases like this would be to defer to the experts, folks like Mr. Hill and administration, to respond to those questions and if need be, and I certainly don't need to be in the paper on a regular basis, but if the paper, did want to speak to someone, and, clearly we're available, for that. And so, for me, I think, again, the people in the know should be the people that, have that information and respond in a professional manner. And if they come back and request, some kind of assistance with that, then, I'm always more than willing to help. And as I'm sure each of our board members are, but, anyways, we missed the mark here a little bit, and we need to do better, and I'm sure we will.
Mr. Chair, could I just say I agree with everything that you said there, and I wasn't looking to be in the paper either. I'm not. Please don't get me wrong. I think all I'm trying to communicate it is I didn't want to be caught off guard like that, and so I'll just speak as well as far as just saying I don't think any of us would want to get caught off guard on any topic moving forward on something that's major and negative. And that was my only wish, to wake up and read that and not be aware of that, to me was disappointing, because I do have people to answer to, the 23,000 people that are my bosses in District 2. Obviously, I don't need to sound like a smart aleck when I say that. I'm just making an obvious point. Thank you, Mr. Chairman.
Thank you. Right. Any further questions on the item? No. Okay. At this time, we'll move to item 7, which is board member announcements and reports. Supervisor Verbruggen.
I'm good. Thank you, sir.
I'm good also.
Thank you.
Thank you, Mr. Chair. Couple of things, continue to work a little more high, helping out with their projects. Volunteer judge at the Lemoore, if that was Lemoore or Kings. I think it's probably the Lemoore Lions Club, their speech debate presentations. Speeches were focused around virtual learning and had a good perspective of classroom learning versus virtual. Also had a chance to walk through the autism awareness event that was at the Hanford Civic Park. A lot of people, nice evening, a lot of activities, a lot of students, and very well attended by the public and public safety. District Attorney Keith Bagundis was there, as well as SWAT units and fire department and ambulances, and then everyone had the ability to walk through a lot of those vehicles, and good public awareness. Attended the virtual King's Partnership for Prevention meeting, received updates from Todd Barlow on the school operations and how they're all adjusting to now hopefully a post-COVID era, and how everything's are progressing in the educational field. Also, Phil from the District Attorney's Office was there dealing with violence during the pandemic. The pandemic has caused a different way of doing business, and to hear the District Attorney's Office perspective on that. The South Fork Kings also had a meeting on the 15th where we received updates on the sustainable groundwater management plans. We also reviewed the upcoming budget. As outlined a couple of times, I think this morning already, the drought conditions, only a 33% delivery on the Kings. We'll kind of challenge our aquifer recharge project. We were going to try to sink about 200 acre feet. It's down to about 20 now, and so we're reevaluating that project. But we'd still like to get some data and try to figure out how to accomplish that task. And then yesterday, Kings County Homelessness Committee met and discussing a couple of projects and maybe a different way of doing things in the future. Also had a developer that was there kind of talking about the challenges of creating affordable housing, not so much in the homeless arena today, but it certainly addresses one of the problems, and that's affordable housing for people. Also had the opportunity to attend the Lemoore Raceway. Kind of set in as a track announcer. So got in on the motorsports.
You get booed?
You know, I was concerned. A person come up and said, you know, I'd sure like to send you to Pismo Beach for dinner and spend the night. I said, yeah, when? Next race. So I'm not sure if that was a good or bad. Yeah. You know, so, but about 80 cars, 5 classes, outstanding racing, cars, racers, crowd was just great. It was a beautiful night. Again, a lot of stuff going on as the Kingsburg Car Show. BMX had a huge event just next door of the Lemoore Raceway. So a lot of things going on in the area and the community. And so it's that part was pretty good, and look forward to seeing what the next couple of weeks come in. The next race will be May 8th, and I'll see if they invite me back. So we'll find out.
Did they pay you?
Man, how do I say that? I did go backwards and pick up a little bit.
Well, I mean, they only get a hamburger or a hot dog or.
Yeah, exactly. With that, thank you, Mr. Chair.
You bet. Supervisor Riley.
2 quick things, Mr. Chairman. One, I do want to thank Greg Gatska. He helped me out. The Business Journal, they did a story covering the Jackson Ranch project. I posted it last week. It's a really good story on positive news here in Kings County, and specifically around the south side of Kettleman City. So I appreciate Greg helping out with a lot of the technical information that the reporter, the kind of questions that he had. And so it made for a very good story on that. So I appreciate that. Lastly, Mr. Chair, I did have a call last week with Mr. Joe Cron from our federal lobbyist. I just touched base with him, followed up on him. It's a 2-way conversation on an update on what he's hearing in regards to the, if anything new in regards to the possible earmark funding in the county's request, you know, as far as our priority of projects. And I shared with him some local updates from Kettleman City leadership as well, and just offered to be as helpful as we can with the job that he's doing for us in DC and relaying to Congressman Valadeo our priority projects. And so in Kettleman City, we don't take lightly the fact that the board prioritized that pedestrian overpass bridge as the #1 project. And we do appreciate that. So we're trying to back up that appreciation with some work ourselves. So there'll be more to come on that and promoting and highlighting that. So thank the board again on behalf of Kettleman City for prioritizing that as number one. And we're going to try to make some noise here to, take our shot here at a long shot possibility of funding. Thank you, Mr. Chairman.
Thank you. Okay, on to board correspondence.
Thank you, Mr. Chair. In correspondence, we have a Tulare Basin Farms petition for change involving water transfer. There's also a notice from the San Joaquin Valley Unified Air Pollution Control District, a notice of public hearing to review the 21-22 budget. Upcoming meetings and events. Central Valley Regional Water Control Board will hold their meeting and notice. There's a notice of their April 22 meeting. From Waste Management, the Kettleman Hills Facility 6th Annual Information Meeting will be on April 21 at 5:30, and that will be via Zoom meeting. Crime Victims' Rights Week, a number of activities. The quilt display on April 22nd from 2 p.m. to 7 p.m. at the First Baptist Church. Also, the Facebook event will begin on April 19th. There'll also be a virtual unveiling of the new quilt on April 22 at 6 p.m. on their Facebook page. On May 4th at 3:30 via WebEx, we will have the Pandemic Relief Funding Programs event for the California and Kings County Special Districts. Upcoming agenda items, there will be a COVID-19 update next week. Also, round 2 of the Juvenile Center Project Construction Award. We're planning on coming to your board. From the Ag Commissioner, there will be an agreement with the California Crop Improvement Association for the seed certification program. Behavioral Health will bring in a First Amendment to an agreement with Aspernet, Wraparound Full Service Partnership and Family Urgent Response System Services. From the Human Services Agency, King's Whole Person Care Extension budget will come before the board. From the Health Department, an amendment to one of their first 5 ordinances will come before the board. From the Assessor's Office, an agreement for outside access to the Assessor's database. Another Mental Health Awareness Month from Behavioral Health. From Human Services Agency, a study session regarding the General Assistance Program. 2 items from the Sheriff, a resolution and grant agreement from the California Department of Parks and Recreation, and an agreement with Securus Technologies. I'm not exactly sure what that's for, but I'm guessing it's for the jail. So that's what we have for next week. Thank you.
Very good, thank you.
Mr. Chair, just to inform the board, the Transit Center project put on by CART, they're starting to do the demolition. So if you want to go by there, they've already got a couple of the structures down. There's not going to be any excavation, but you will start seeing some buildings come down and cleaning up that part of that, the first phase of that construction. So they are on site, they are working, and they are cleaning some of that up. A couple of the structures are already down and hauled off, and really cleans up that part of downtown Hanford in preparation of that project. You get a chance to go by there and see that redevelopment agency, redevelopment plan come to reality.
Awesome. Okay, move to item 8, which is closed session litigation initiated formally. The title is Leprino Foods Company versus County of Kings. Case number 20C0159, or those could be O's, I'm not sure, but that's conducted under Government Code Section 54956.9D1. Madam Counsel, do you expect any reporting out?
I'm going to defer to Terry Woolley, who is advising the board on that matter.
Ms. Woolley?
No, Mr. Chair, we do not expect any reporting out on this one.
Very, very good. Thank you. Okay, well, that will bring us to our final item, which is adjournment. And if there's nothing else to come for the board this time, we will be in recess till April 27th, 2021 at 9 a.m. Thanks for your attendance.